Hi, can anybody hear me? This is my first call on Zoom, so let me see if I can open my chat and see if you guys can hear me. Can you guys hear me? If you can, open the chat. Let's see. Oops. Okay, I'm trying to see if you guys can hear me. Hello? Hmm. Let's see. Can you guys hear me? I figured that part out. Audio. Can you guys hear me? Let me try to see. Can anybody hear me? Hey everyone, can you guys hear me okay?
I can hear you.
Okay, great. I am just learning this Zoom thing, so I just want to make sure that everyone can hear me. Sounds like Magic, you can hear me. Can everyone hear me? If you can, just open up your chat and just let me know. And thanks for your patience. Okay, awesome. Sounds like most people can hear me. I'm going to mute everybody for now, just in case that is easier to focus. But you guys can still hear me, right? Okay, cool. Okay, sounds like everybody can hopefully hear me. And then let me share my screen. Thanks again for your patience. Okay. Okay, so for now, what I'll do, let me see if I can get my chat up, is I will, I'll have you guys unmute, but maybe what I can do is just make sure that the chat is open. And that way, if you guys have questions while we're going through the PowerPoint presentation, because it's more of a talk as opposed to actually seeing me, although we do have a video, as opposed to seeing me do the massage, then just type a question in and we can unmute you. We can make it really casual. We do have a question time at the end, but just in case you're like, wait, no, I want to hear about this specific thing. Just let me know. But I feel like it's 5 after, so I think probably probably it's an okay time to start. Let me just make sure no one else is trying to come in. Nope, we look good there. Okay, so I am Claire Primo, and it says Claire Martin. That's my maiden name. But I've been, a little bit about me is I've been working with Dr. Angie for since 2014 as her veterinary nurse. So I'm sort of her holistic veterinary nurse, and I've seen the practice grow in Boulder, and I've been a large part of it on the back end for all of our family in the whole country, really, beyond the practice here. I communicate with a lot of people through email, through phone. So you may or may not know me, but if you hang out with us long enough, you certainly will continue to get to know me. So I'm a veterinary nurse, and before Dr. Angie, before becoming a part of her team in 2014, I was a nurse for animals for probably almost 10 years now. And in 2015, let's see, let's just deny that. In 2015, I became certified in animal massage. I went to the Rocky Mountain School of Animal Acupressure and Massage and became certified, and have since opened my own practice outside of Angie's as well, where I do house call animal massage, and I also do veterinary nurse needs. So if somebody needs something at their home, then I can help with that as well. So I'm just admitting one other person into the chat. So hello, just introducing myself. And then I also am working on my acupressure certification, so working on getting certified in doing animal acupressure. And it's amazing what I see massage help with, and I hope from this short conversation that you can gain at least a little bit of empowerment on how to help your own animal with it in your own home. And yeah, let's get started from there. So the first slide, I go over conditions that massage can help. And of course, on here, the list could really go on and on. But the main things that I work with in the practice would be arthritis. I see it be a game changer for senior animals that have body pain. For cats, a lot of the times we don't have the same pain medication, so pharmaceutical options that we do for dogs. We know that we don't have great NSAID options. So for dogs, we have Rimadyl or Carprofen, whereas for cats, we don't really have those options as much. And so Dr. Angie's practice, and with her patients, she's really seen massage for cats be incredibly, profoundly changing their lives in a profound way. Post-operative, this is more of the medical side. So if your animal has a surgery, definitely orthopedic. If they have knee surgeries, that's a huge one for dogs. Even if they just had a dental surgery where they had, teeth extracted, that can really affect their jaw, their neck, their whole body tenses up. And so we see huge use for post-operative. I would say in the practice, mostly orthopedic. So knees, things like that, hips, but it can really help with almost anything in that regard. And then mood. So if your animal tends to be anxious, definitely if there's grief in the house, if there's been a pet parent that's been lost, or another animal in the home, or just a huge shift, maybe a person has left, gone to college, something like that, anything like that, they really feel grief. That's my experience. And of course, stress. So if they are feeling stress from even those same experiences where they might feel grief. So somebody's been lost, or somebody left, or a big move to another home, another state. Maybe somebody's coming into the house. So for stress, it can be hugely helpful. We really see it help in so many of the same ways that we see it help with our own lives. Animals get a lot of the same conditions that we get, and they can really benefit from massage. So just diving into a little bit more about what it does and how it does benefit. So it decreases stiffness and inflammation. This is going to be huge for arthritis. It increases blood flow to those muscles. So it's bringing oxygen into those muscles, and it's bringing blood flow, which will help reduce with muscle wasting. I'm sure for the senior animals that you've had or have, you'll notice, especially on their hind legs or that area where they'll get some muscle wasting and their muscles will look smaller. So massage can really help with that, what we call that atrophy, muscle atrophy, muscle wasting, and it can really help with that. It decreases healing time. It looks like we have one more participant trying to hop on in, so we're gonna get them in. Hello for the person that just joined. We just started. We're going over the benefits of massage. So it decreases healing time. So if there's a surgery or anything along those lines, it helps with that. It boosts feel-good hormones, so oxytocin, all of those good serotonin, all of those different hormones that we release when we're feeling good. It can promote that. We talked about the reducing of muscle wasting, and it stimulates acupressure points. So even if you don't know where those acupressure points are, you're definitely stimulating them by massaging. So I think the really great thing about massage is that you can definitely hire a certified animal massage therapist, but in a lot of ways, even if you're not sure what muscle you're working, or you don't know what acupressure point you're activating, you're definitely still doing something, and your animal talks to you and communicates to you. And so you will know when you're doing something that they enjoy, and you will know when you're maybe hitting a spot that's more tender, or something's getting activated in them. And of course, acupressure points are just the same thing as acupuncture points, but we're not using a needle for that insertion and that activation. We're just using your fingers. Hospice care. So this is something that I'm very passionate about. So hospice is, of course, huge in the human world, but it's not as huge in the animal world. And I really advocate for it to be, because we spend a lot of time working with our puppies and getting puppy packages and making sure they're set up for success. And I think that our senior animals deserve that same respect, and they deserve to be honored in that way as well. And that's what hospice care is to me. It's providing that animal with, as much natural care, palliative care that they can get without a lot of medical intervention. And so massage has a huge place in hospice. And then connection. I mean, really, massage is a huge way to connect with your animal. And early detection. So that's really finding things. Maybe you find an area that is more painful than you feel that it should be with your animal, or you find a lump because you're massaging the animal that you maybe wouldn't have felt if you weren't massaging. And at that point that you want to get that addressed. So early detection has a great benefit for that as well. So they're really, the benefits just kind of go on and on. Let's see if I missed anything on my notes here. The only other thing that I noted in here was just that I think massage has been used in the equine, so the horse world and agility dogs, for a really long time. And it's just now kind of coming to light to be as impactful in our companion animals. So I think you'll start to hear massage therapy coming up more and more for our animals that are our family, and not just necessarily animals that are working animals or horses or things like that. So I thought that was just interesting and really nice. So this is the first stroke. So I'm going over, I don't know if you guys can see my chat box. Let me put it in the corner there. So of course these strokes have very fancy French names, but I have kind of made them their own little name, and we can definitely dive into those other names if you want to have them. I can just tell you them as we go. But the first stroke is the petting stroke. And this is the introduction stroke. I'll just tell you, it's effleurage. It's just kind of a long word, but that's what we call it in human and animal massage. It is an introduction stroke. And the way that I recommend starting, and the way that I do it, we have another person coming in. Let me just add them in. Hi, Vanessa. I am just now starting on the strokes of animal massage. So the first stroke is the petting stroke, and it's called effleurage. That's the fancy French name for it. It's the introduction stroke, and I have a video later in our talk here where we'll kind of go over it and we'll watch it. But it's just long petting strokes from the head to the tail of your animal. And I recommend keeping all of your fingers together and a little bit cupped. So your hand would look a little bit like kind of how I have it right now. I don't recommend having your hands, your fingers long and spread out. I recommend a cupped position with the fingers close together. And you would start from the head all the way to the tail. And in the beginning, you want to do 3 of those strokes. And what's nice about it is it's just a nice gliding stroke. It feels a little bit like petting to your animal, but our animals are so intuitive that they're going to know that you're not just petting them. They're going to know you have a different intention. And actually, while you're doing this is a great time to set your intention. So what are you trying to achieve in this massage? We'll talk about that more a little bit later as well, but I'll dive into it now as well. Do you want it to be invigorating? Are you trying to stimulate a senior animal? Or are you trying to calm that senior animal? Are you trying to calm, your cat or dog that is feeling anxious or stressed? So knowing what your intention is going to be huge. We have another person joining. Let's go ahead and get them in. Hi, Sandra. I'm just now talking about the petting stroke. And this is also a great time to assess the body for areas of warmth, areas of coolness, your animal's reaction. After the effleurage stroke, I recommend doing what we call a freestyle, and you'll see this in the video as well. It's really just using these strokes all together for about 5 minutes if you can. And freestyle is just the same. It's very similar. Let me add this next person here. It is the time to assess your animal. So warmth is an indicator of, at least from our traditional perspective, warmth comes from inflammation. So we see that when there's inflammation and pain. So if your animal has hip problems or sore hips, then you might notice that you're going to feel more warmth when you palpate at their hips. And you really will start to get very good at noticing these temperature changes. Areas of coolness are definitely less common in my experience, but from that traditional point of view, it would be more of a lack of circulation. So if your animal's not getting the kind of circulation that they need let's say a limb, you would feel a coolness. That is certainly less common. You're likely going to feel more heat than anything. And this is a good time to see your pet's reaction. Are they really enjoying this? Are they feeling a little bit uncertain? A lot of the times when I go into a massage, a person will say they are going to love it. And generally they do, but a lot of the times in that first 1 or 2 sessions, they're really feeling me out because, like I said before, they know that my intention is completely different than a pet. It's more of that connection or assessing for tension. They know that there's something going on. So see what your animal's telling you, or listen rather. It improves lymphatic circulation. So the lymphatic circulation is getting all of our white blood cells moving, and so that's increasing immune function. And this stroke is particularly good for that because we know that when we're activating the lymphatic circulation, you actually are doing it more on the surface of the body and not as deep. So you're not doing like this deep sports massage that we would expect. That's really more activated from a light, gentle effleurage or petting stroke. It's simple and detoxifying, extremely detoxifying. We just talked about the lymphatic circulation. And again, set your intention and connect with your animal. So that's the introduction. That's the petting stroke and the freestyle. This one's called the making biscuit stroke. And I think that's fun because we know cats love to make biscuits. But this is more of like another kind of warm up. It's called Petrissage that's the French name for it. And it can include circular strokes where you pick up and squeeze the muscle. And when I was learning, really a great way to think about it is when you're kneading bread. So if you're kneading the bread, that's kind of exactly what you're doing to the muscle. And I find that they really love this. This is good for a big muscle group. So on this picture, you're seeing, around the shoulder. So it's great for that area, for the shoulders, down the limbs of the body of the animal, in regards to the back of the dog, kind of the same area that you're seeing on this image. We'll talk about that muscle more, but it's a great spot for those large muscle groups. Another way to perform this stroke is compression. So that's a gentle, soft squeezing of the limb. So what you're doing there is you're taking the limb, and this is great for the actual limb. So you're taking your hands and squeezing, and just squeezing. Again, your fingers are together and they're cupped. And it's really gentle. And what I recommend doing is once you've gone down the leg, you'll come back up the leg as well. And that is because we want to increase the circulation and the blood flow back into the core of the body. So in the video that we watch, you'll see where she'll go down the limb, but she'll always come back up. And that's because we're bringing the blood flow back to the body. And this is a great one for reducing the muscle atrophy because we're bringing that blood flow to those muscles. So we're really getting things going. The way I talk about it a lot is it's an aerobic activity. So it's sort of like exercise, although you're not really activating those muscles, but you're working those muscles in a way that you wouldn't if they were just sedentary or laying there. They were just not moving the same way. So it's huge for keeping blood flow and keeping the muscles healthy. It works really great for that. So the circle stroke, so this is often what we consider, and we're not treating anything necessarily like medically speaking as a doctor would, but it is sort of a treating stroke in that once you find the tension, so often with the circular strokes, the making biscuit strokes, you're really using this time as you kind of get to know your animal and do this more. You're really using this time to finding that tension. And it can take a long time. I mean, even after I went to school and got my certification, you really the more you have your hands on your animal, the more you're going to really feel that. And then once you find those areas, you can use circle strokes. So you can use your palm or your fingertips or your thumbs and really just kind of get in there. And less is more, because for our animals, we don't necessarily want to go to the same extreme of, I don't know if you've had a massage where like how that really is a lot, but you don't necessarily want to do that for your animals. They're very, very receptive to this. And they don't need a lot. You'd be really surprised at the amount that they need. And it's usually not a ton. So if you're doing massage and you're finding areas of tension, and maybe it's related to stress, or maybe it's related to arthritis, or maybe it's related to something from that surgery that they had, then you can use this technique to really loosen up the tension and the tightness. So this is what we would call really like the treatment stroke. So they go in this order. You would open with the petting stroke, then you would go to the making biscuits stroke or the Petrissage, and then you'd find that area and you'd do these circles. This is often called friction in the human massage world. And then I always close with 3 effleurage strokes again, so 3 of the petting strokes. And I have a picture here before we go to the video that has just the areas of the body that holds the most tension. I wasn't sure if you guys would be interested in hearing the muscles because there's a million muscles, right? I mean, we're like all muscle and skeleton, but we're so much muscle. And so I will go over some of the main ones. We won't go over, the hundreds or dozens of them, but this is a picture of the dog, but only, and I desperately wanted to find one of the cats, but I just couldn't find one that did the cat body. It just didn't look great. It would be like so just know that on this body is the same as the cat. And if you want me to email you a cat one, I'm happy to. I couldn't find one that looked appropriate. But on the left side here, you'll see the areas that are the primary focus that I see the most tension in, regardless of why we're massaging. It's the neck. I didn't put it on here, but the head, definitely. I'm sure you feel the same way sometimes. If you're tense or you're in pain, you will lock that jaw, or you'll just kind of hold your face in a really tense position. And it actually almost sometimes takes more work to just kind of let it lay. So they have that too. And so the neck is huge. Shoulders is huge. We'll talk more about the areas of the shoulder, but for the muscle, and we'll look at it in the video, it's the tricep muscle that I see it the most on. So for dogs and cats, it's going to run right along the back of their arm, from their shoulder almost all the way down to their elbow. It's a very big muscle, and it's very tense a lot of the times. So if you're finding that on your animal, just know they're not alone. It's an area that they hold a lot of tension in. They're on all fours, so they're using that forward body so much more, and actually they carry 60% of their weight in the front end. So if you think about that, that's an area where they carry most of their weight. And then the back, the paraspinal muscles, there are a lot of muscles, and I recommend always massaging the back with 2 inches from the spine on either side. And then the hips. Oh, and also actually on the shoulders, the trapezius muscle, which is an upper back muscle. We'll kind of look at that in the video as well. That's a huge one that's often tight. And then around the hips, so the gluteal muscles, that's just right around on this area. If you look at where they have the croup and the hips, right around here is the gluteal muscles, and they are often extremely tight. And, while you're doing this, there are tons of trigger points. I don't know if you probably wouldn't be going deep enough for them, but know that you might be activating them as well. But the gluteals, and then where it's pointing at the thigh, there is a large muscle here called the Biceps Femoris. And that is a muscle that you can really work well with very minimal, knowledge on the anatomy of an animal, and do a lot of service for them. A few other things, I often have people ask about where the elbow and the knee is. The elbow is, of course, in the front, and then the knee is also called the stifle, and so that's in the back here. Animals that have knee surgery, they often, if not always, have lower back pain, and then animals with lower back pain often have knee stuff. So everything's interconnected, and it's fun. So this is the animal, the anatomy of a dog, but it's also the anatomy of a cat. And really, the anatomy of an animal is very similar to us. So if you look at your own body, if you wanted to ever look at the muscles, in an anatomy book for a person, they're very similar. Just imagine yourself on all fours, and it's pretty much that. So I have a video here that I want to go over, and it's 5 minutes. So hopefully it doesn't feel too long or excessive, but I'd like to talk through it with you guys. So this is the school that I went to, and so she's going to start with opening. She's starting with the petting technique, which is effleurage, and she's starting, again, like we talked about, from the head all the way down to the tail. She's working on a dog, but obviously you can definitely you would do the same thing with a cat. They're not always going to be this calm necessarily, and that's okay. You can definitely massage an animal that is upright, that's curled up in your lap. Maybe they're sitting on their hind legs. You can do a lot. And so I just want to mention that you can absolutely, massage anywhere. Now she's going on to the freestyle. So again, recommending about 5 minutes of your initial massage being freestyle. And that's where you're really doing a lot of your strokes. Right now, she is doing the making biscuits, so the Petrissage. And you just feel the whole body. Again, you're going from the head, down the forelegs, along the back, down the hind legs, and you want to come back up. So you'll see that she comes back up the leg. And this is a good time. I want to pause because I want to remember to talk about the pause. This is a good time to, again, assess for heat, assess for coolness, their reactions. It's a good time to set your intention, to let them know your intention if you communicate with your animal. And I want to talk about the pause because I feel like they're often forgotten. And when you work on the paws actually have a lot of ting points in them. So they have a lot of acupressure points. And I would recommend, sorry, I want to just make sure I go over this whole video. I would recommend when you work on the paws to squeeze each digit just once, and you can really activate the ting points, the acupressure points there. And then another thing that I would recommend, and my teacher in school taught this, and I really feel like it's true, is going between the webbing of their paws. Because I think we forget about that, and we forget about how much they're on all four, and it can be hugely impactful for them. So just don't forget the pause. And now she's kind of doing what we call the circle strokes, kind of along the back. And, you know, if she really sat there and assessed her animal's reaction, there was a little bit of a reaction at that lower to mid back. I hope I'm not going too fast for you guys. I want to make sure that I'm really covering this because the visual is extremely helpful. So now she's going to the pectorals. So the pectorals are the chest. They're the front-loading muscles, and it's just that chest muscle, and really just kind of scooping that area and kneading that area is, oh, they love it. They tend to really love that spot. And it's often forgotten, and it feels really, really good. She's going above what we call the rectus abdominis, and then right around the lower back here. So this is an area that is huge for our senior animals. Very often cats that have arthritis or pain, oh my gosh, it's so common to be right where her hands are. This is the lumbosacral spot. And this is where the spine, the lumbar part of the spine meets the sacrum. And so it's the lower back, kind of like where your lower back is. But it is so common to be a problem in our senior cats. And it's a huge one. If a dog has a knee issue, it's right around here. So just on either side of that spine, about 2 inches away. Now for a cat, I'd say about 1 inch. But about 1 to 2 inches away, just really working that area, just gently kneading with your thumbs on that area, and really spending a lot of time there. I think you'll find that there's a lot of heat there too on your animal. She's also, of course, working right around the hip area. And then where she's at right now, that is the gluteal area. So those are the glutes. If your dog has hip issues, even if they don't, this is a great spot to work. A lot of trigger points there as well. And so the gluteal muscles are hugely impactful. And now she's going down the biceps femoris. That is a big chunky muscle on their thigh. And you can just really work it with your thumbs. She uses her thumbs a lot. You don't have to use your thumbs. You can do these circles with your palm. You can do them with your fingers. Like I said, like kneading bread. So you can really do a lot with that big giant muscle there. And then she goes all the way down again to the paws. I would recommend squeezing each she does it actually, each toe, and then going in between the webbing, and then you'll come back up. So she's doing compressions back up. And if you ever want to do, if we want to go over this again, if you have questions, we can definitely do that. And then don't ever forget the tail. On a cat or a dog, the tail is a part of the spine. It's a part of their back, and it's hugely important for them. And so when you're working the tail, we just recommend just exactly what she did, gliding off of it. You can also do circles, so you can hold the base of the tail, and you can put one hand on the rump of the animal, so the butt area, and then you can take your other hand with the tail and do clockwise and then counterclockwise circles, and then slowly move your hand all the way down that tail. So now she's come back up to the head. I'm not sure why they do this in this video, but it's totally fine. She's doing circles around the animal's ears, and massaging ears is great. There's a ton of acupressure points in the ear as well for very, very calming, and just, rubbing and kind of squeezing the ear. I would do this. I do my sequence from the head to the tail, so I would do this in the beginning. But look for those signs. So that dog just lifted her head and yawned. That could have been a sign of being a little bit worried. It could have also been a release. You'll know more with your animal. Sometimes a yawn is stress, and sometimes it's release. At the bottom here, they're going over the neck muscles. So she's really just, the neck's a great place to use those big making biscuit techniques. So the Petrissage, but there's a lot of amazing muscles that you can get right there that run along the side. So if it was human, it would be on either side of your neck, and it feels so good for them, and their neck can be so tight. A lot of the times in Dr. Angie's practice, we'll find an animal that has, lameness or limping of their forelimb, and it's actually a tight neck. That's how much the neck is. That's how important the neck is. They actually have muscles that run from the neck all the way down their leg. And so it's huge. It's huge. You can really have forelimb limping and have a neck problem. And they love it. I mean, you can see this dog right now. And same with cats. They absolutely love the neck area. So let me just see if I can, let's see, how do I get this? That is not what you guys want to see. That does work. I get back to, here we go, the presentation. Okay, so I hope that was helpful. If we want to watch that again and go slower or pause in certain areas, we can. I really want for this to be something that you feel more empowered to do at home. So setting up for success, these were just a few other things. So a few things that I don't have on this PowerPoint is I start from the head to the tail. You don't have to, but it's good to have a system, or not a system, but what we call a sequence. So when I was learning in school, you have a massage sequence, and that's what you just saw on the YouTube video was a sequence. And so whatever that sequence is, I just keep it consistent. And I mean, just like a veterinarian does the exam from the head to the tail, they don't start at the tail. That's what I do. And again, just don't forget the tail. Softer is always better. Less than 2 pounds of pressure. So what I would recommend is if you have a scale at home, I would put your hand on it until you reach the 2 pounds, and you'll be shocked how little it is. It's not a lot. So if you feel like you're getting really deep in there, you're definitely going beyond 2 pounds. It does not take a lot. And in fact, when I have been working in settings in people's homes, I find the best results are when I am going softer. You feel like it shouldn't because you interpret it with your own body and how you handle massage, but especially when you're first learning, and especially as your animal's getting used to the actual experience of body work, less is better. Breathe. So you'll be interested when you start to do this, or you feel nervous, or just remember to breathe. So each stroke, just try to make sure you're also having a breath, because your animal feels that. They do feel your own energy. So making sure that you're doing this at a time where you're okay mentally and emotionally, and you're feeling very present. I won't even really, if I can avoid it, I won't do a massage anytime if I'm not there, or I will make sure before I go into an appointment that I'm really taking 5 minutes to ground, to breathe. Maybe I'm doing a very quick, meditation by myself in the car even. But anything to keep myself, make myself back into awareness. And if I can't do that, especially, at home, then I would wait for another time, because our animals are going to absolutely take that on. And I'm sure that you have experienced that in your own life, where they are sponges and they just suck it up. So, on that line, choosing a comfortable space and an ideal time. So if you have family, making sure ideally that it's not the time where they're coming in and out, making sure that it's a comfortable spot, not only for the animal, but also for you. I mean, do you feel better doing it on the bed, or do you feel better doing it on the floor? What is easier for your body? Because the more comfortable you are, the more comfortable they will be. And then if it's not working that day, try not to stress about it. Just figure it out another day, find another day to make it work. And I know that when Dr. Angie was working in rehab, and she would give, animals techniques or exercises to use at home, oftentimes just turn on the TV, or, try to be a little bit distracted at first, maybe, if that kind of calms your nerves, if you're feeling anxious about it in any way. And then setting your intention, like we talked about in the beginning, but this is really huge. I mean, knowing what you are hoping to achieve in this session. I think intention is everything in life. So I think if we're entering the massage with an intention, we're going to have a lot more results. Connecting and having fun, that goes without saying. I think sometimes, though, we get so serious and we are experiencing a hard time with our animals, or they are going through a hard time themselves, and we're so tunnel vision with it because we're trying so desperately to make them feel better. And I think just knowing that you are doing a great job just by doing this, and trying to allow for this to be a moment of connection, a moment of peace in the midst of it all, in the midst of the medical whatever, in the midst of the life happening beyond the medical situation of your animal, or whatever it is, or if it's hospice, really trying to use this time to connect and see what your animal is asking for, even though at that moment you might be feeling the grief of the transition. And yeah, I feel like a few other things that I haven't mentioned. Phantom leg syndrome. So that's something that like our veterans experience if they are, or others that have lost a limb, or something along those lines. If you have what we call a tripod, which is an animal with 3 legs instead of 4. I know in the human world, the people that have had amputations or anything along those lines feel phantom pain. So they feel that pain even if that part of their body is no longer there. And for our animals, we can only assume that if we have that experience, that they have that experience too. And so that can go for a tail, that can go for a leg. I mean, really, that could go for the ears. So anywhere that they've had, some sort of issue where they've had an amputation or anything along those lines, I just still, and my business partner, who's also a massage therapist, does this too. I just still do an effleurage off of it. Or, I was talking to her the other day, she'll still do compressions, so gentle squeezes. And I think it's important to remember that. And then the last thing that I didn't write on here that's huge is thanking your animal. So make sure that when you are done and you have finished your massage session, whether it's been 5 minutes or 30 minutes, make sure you thank them. And I literally thank them out loud, but you can thank them. I thank them inside as well, and let them know that I appreciate their letting me work on them and their patience and that ability to connect with them, because they didn't have to let us do that. And the fact that they do is really profound. So let me see if you guys have questions. Let me see. Actually, I might have more slides. I'm not even sure. Actually, no, that's it. So let me see if you have questions. Let me know. Let's see if I can. You can type in the chat box, or we can look at trying to unmute everybody. See if we can figure that out. I'm sure I can figure this out. participants. Let's see. Unmute all. Okay. Okay, I've unmuted everybody. So if there's a lot of background noise, we can mute them again. But I wanted to see if anybody felt like they had questions, if they want to watch the video and talk about the video again, or anything, any questions at all. Jump in. And if you
I have a question. My cat has autosensitivity on the back of her back. She got arthritis real bad and along her hips and stuff. She can't really sit down very well. How should I handle that area?
Okay, so I want to make sure I hear you correctly because it's a little muffled. So did you say your animal has hip and back pain?
Yeah, she has arthritis in her hips and in her back.
Okay.
And she doesn't sit down very well because it's so sore. How should I handle that area?
Right. So are you wondering if like how to position her for the massage, or just how to handle that area in general, or both?
How should I touch her?
How should you touch her? Yeah. So I mean, first get her in the most comfortable position. If she can lay down, that's great. And then I would just make sure that I would really work on the paraspinal muscles of the back. So on either side of the back, I would do gentle, like I would even just kind of strip down each side of the back with my thumb really lightly. And then you can even do, what I would do is kneading strokes with your thumb along each side. So one side and then the other. And I would just, I'm not sure if you can see me, but I would take my thumbs and I would just, can you see me or should I?
No, I can see you.
You can, okay. So I would take my thumbs and literally just kind of knead along the back. And then when you're opening the session, let me see if I can, let's see if I might need to mute everybody and get just you on. And who am I talking to?
Lynn.
Lynn. Okay, let me mute everybody. I'll mute you.
That's a little kinky underneath. Oh,
See, is everybody muted?
A cat.
It's a little kinky around the tail.
Let's see. Is everybody muted or no? Let's see. No.
Oh, I'm sorry, babe. I'm sorry. Ouch.
Sorry, everybody. I am just now learning how to.
Put your bum over. Here. Turn your hind over.
Mute. Okay, I think I have everybody muted, so let's see. Okay, Lynn, are you there?
Yes.
Okay, excellent. Just learning the ropes here. So yeah, so I would take your thumbs and I would knead each side of her back. And before you do that, in the freestyle, I would feel and assess where you're feeling heat. But you might already know. Do you feel heat on certain areas of her back or her hips?
Yes. Yeah.
Okay. So then that tells you that that's the area that you need to work on the most. So I would start with the effleurage, and then I would knead with my thumbs and just go real gently. If her hips are an issue, you can also do what I call the gentle direct pressure around the point of hip. So on each side of her, you can usually feel the point of hip, especially if they're older. Sometimes you can feel it's more prominent. And you can just take your thumb and do direct pressure around that hip bone. And then, yep. And then what I would do is the compression stroke. So I would take my hand, and instead of using my thumbs, I would use my whole hand around that hip area and then go all the way down the leg and then back up.
Okay.
So that's what I would do. And I mean, you may feel tension in a certain spot and you may not. A lot of the times you're looking for the way they respond, that heat element, and then also an actual reaction of the muscle. Sometimes if you're actually working on an area that's really tight, you can literally physically see the muscle spasm. In which case, for sure you need to be working on that area a little bit more.
Right. When I pet her in that area, she always pulls away.
She always pulls away. Exactly. So I would just do as much as she's comfortable with and then slowly do a little more. So in this situation, you might start with like 10 to 15 minutes at night. And then you might work up to 15 to 20. And then you might keep working up, because the idea is that if you're doing it regularly, you're going to feel less heat and you'll feel changes happening with her body and she'll become more receptive. And the other thing too is I wonder if when she reacts, if you go a little lighter on your pressure, little lighter, and see how she responds with that. Because like I said before, oftentimes the less is more in this situation. Yeah. And so if you're finding that, you can definitely kind of ease it up and see how she responds. Because even if it's super light, you're still working that muscle. And not only that, but you're definitely working the lymphatic system. So you're definitely boosting her immune system. So that is what I would do. And I would make sure you work down her leg as well, because the likeliness is that if she's got that hip and back tenderness, that her hind legs are feeling it too. Does that help a little bit more?
Oh yeah, definitely. Okay. Definitely. Thank you.
Okay. Thank you. Good. Yeah, you're so welcome. Hope it helps. Let me know. Okay, I'm going to mute you back. See how. Okay, so let's see if Amy is here. She might have left. I think she left. But she asked, is it necessary to massage the paws? My cats aren't keen on having their paws touched, especially their individual toes. No, it's, oh.
Come back, please. Daddy's not back there.
Oh, I must have somebody else unmuted. So that is not necessary. You don't have to. So the paws just, I mean, maybe that's more for dogs, but I have met some cats actually that will let you, shockingly. But it's just really helpful. So if they will let you, I would do it, because each little pad has acupressure points and you can really activate them by simply just pressing. So you just squeeze each paw, but you don't have to. None of it is a have to. You can definitely not do certain areas of animals, or if your animal hates having their ears touched, which is not uncommon, that's a common thing, just don't do it, or if you're trying to desensitize them to it, maybe just, touch and let go. And that's it for that night, or that's it for that week or month. Maybe they'll let you then squeeze a little bit, just a little gentle squeeze. But no, any area that's not fun or they're not keen on, don't do it. I mean, this is supposed to be a great experience and a good connection. And if you're getting the benefits of releasing the tension and finding those areas and releasing it, that's great. But I think the priority is to connect and feel like that's, that you're not doing something that they don't like, that's certainly not the intention. So yeah, you can definitely avoid that. But on that note, if they do let you touch their paws, then I also do go between the webbing. So so I do each pad, and then I go in between the webbing as well. Let me see if I had anything else, and let me know if you guys have any more questions. Just go into the chat and oh, Lynn has another question. Let's unmute Lynn. Hey.
I'm always afraid that I'm going to hurt her.
I know.
Is there, as long as I'm gentle and stuff, that's not going to happen, is it?
That's not going to happen. You're not, no. I mean, you cannot hurt, and I have heard this from veterinarians, holistic veterinarians, and I really believe that, oh, somebody's trying to get in. Let's get him in. It's the end of the show, but we'll answer all the questions. No, you can't. I mean, the only things that I would say is make sure you're not pressing on that spine. So for a cat, I would make sure I'm an inch away from the spine, and for a dog, I'd make sure I'm 2 inches away. So you definitely don't want to, massage that spine. So that's the thing that I would definitely avoid. But no, I mean, as long as you are connected to that animal and you cannot hurt, you cannot cause damage from the massage. No, it wouldn't happen.
So if I'm rubbing her from the head to the tail, I would come along the side of her opposed to across the top of the spine.
Say it again.
If I'm rubbing her from head to tail, just rubbing her from head to tail,
Yeah.
In the beginning, I don't go across the top of the spine then if that's where the sensitivity is.
Exactly. Don't go across the spine. You'll go on either side of the back. So
Okay.
yeah. And the either side of the back has, I mean, tons of muscles that are superficial, that are deep. And so, yeah, we want to make sure we're getting those and we're not going on the spine. So that's a really good question because it's good to clarify that. Because you will find, and especially your dog, since you said that she has back pain and hip pain, you're going to feel it along the back.
Right.
So
So she's all bones.
what's that? Yeah, no bones. And then the other thing that you can do, and we can look at it in the video, is you can rake, what we call raking the intercostal space of the ribs. So let me go to the video because that's going to sound really foreign. But it's really easy. And my husband actually pulled one of his intercostal muscles and it hurt real bad. So it's very easy. And let me see, we might have actually already passed it when she did it. I'm going to try to get to that spot. But I think for your dog,
Got a cat.
I think your cat would really like that. I'm sorry.
Okay.
Let's see. Yeah, it's all interchangeable. Let's see. So, oh, I see it. So right here, I'm going to pause it. She is raking the intercostal muscle, and you can do that with your cat. I mean, so just take your hands, and this is the only time, I know that I've mentioned where you don't want to have your hands open. You want to have them together and cupped. This is the only time that you'll have them open. Is your cat, is she thin or is she kind of overweight?
She's very thin.
She's thin. So you'll be able to feel them. And the idea is that when you have your hands separated like that, you can literally get, like, you can feel in between that, the muscle in between the rib. And that will feel really good for her. But the fact that you have a cat, I'm sorry that I missed that, makes so much sense for the hip and lower back pain. I mean, that is just like, it's classic. And we really see so much help with senior cats with body pain, even if they're not senior cats with body pain.
It's 18 Sunday. I'm trying to around.
Yeah. So let me know. I think you'll find that it's going to be super helpful. And just yeah, no worries. Okay, let's see here. So we have Sandra. She says, can I massage shortly after my pup has a seizure, or should I wait until much later? Ooh, that is a really good question. And it makes a lot of sense that you would be incorporating massage for your animal, because I'm sure, let me unmute you.
Yeah, I'm unmuted.
You're unmuted. You're just quiet. Thank you.
Yeah.
So Sandra, okay, so you have a dog and they're having seizures, and does he or she seem anxious after them? I'm guessing, or totally normal?
Sometimes, because when he has seizure, I kind of walk around and talk really softly to him, and I hold him in my arms and stuff. So when he's finally finished, he just kind of lays around, and I just stay with him on the floor.
Yeah.
So I'm thinking maybe at that point I could start to rub him a little bit. And
I think that's a great idea. Yeah. And I'll check in with Angie and see if she thinks that's not, but honestly, I feel like that is an excellent time to incorporate massage. Absolutely. Because yes, totally. I think that's a great time. And if he or she, I'm sorry, I missed the gender. He. Yeah. So if he's already just laying there, I think that's perfectly fine. Absolutely. Yeah.
Okay.
Yeah.
Yeah. Thanks.
You're so welcome. And I think also for stimulating those good hormones and kind of releasing oxytocin, and ideally if there was any anxiety, or just even sometimes I think after seizures they do get anxious, and other times I think they get a little bit like that far 10-mile gaze, and if that can kind of help ground him back to reality, I think that would be wonderful. I would say less is more, of course, and the intention of grounding at that point, the intention of kind of coming back and feeling together in your body again. And then let's see, Joy says, sorry to be joining late. No problem. Wondering about massage for my cat with IBD, especially during flare-ups. That is a really good question. I think so many kitties. So Joy, let's see. Are you there, Joy? Can you hear me? Are you unmuted? I muted you. You're unmuted now. Do you want to talk? She might not be able to. Okay. Joy, no problem. Let me know if you want to hop on and talk. But if not, that's completely fine. My guess is that your kitty is a senior, or at least getting to be, because you can hear me. Okay. Let me know if you want to talk, though, if you want me to like unmute you or anything like that. Turn your audio on. But if not, no problem. So my guess is that your kitty is a senior because so many senior cats get IBD, and it's so unfortunate. And yes, I think that when our animals have flare-ups or GI upset or anything along those lines, especially if he or she is then vomiting or having diarrhea, I think just the nature of that causes us to be stressed and tense. But I think also the action of it. So if your cat's vomiting during these episodes or having diarrhea from these episodes, there's pain that happens associated with that with our body. And so I definitely think that you can massage. And, you know, I would feel him or her out. You know, are we really in the middle of a flare up where you don't want me to touch your abdomen? But I did have a case, and it was actually Dr. Angie's patient, and I massaged him for years. And he had very bad IBD, and he did very well. And we did incorporate a little bit of gentle abdominal massage in. You would want to be really gentle because there's of course organs, but I think even if you didn't do that and you watch the rest of this, if you'd like, I can send you this PowerPoint presentation, the video, and if anyone here wants it, we can email that to you. But I think even if you just did the whole body, I mean, I feel like you could really release some tension and really allow them to feel better, because feeling painful is stressful, and we hold all of that tension in our body. And then again, with the mechanism of vomiting and diarrhea, that can really cause your body to get out of whack too. Goes through rounds of vomiting, ulcers, and constipation. I'm so sorry. That is so painful. Yeah, I think he would do great with it then. Okay, I'll make sure that if you want, I don't know if you want to put your email in here with everybody, but I will find your email, and I'm making a note here that we'll send you the presentation. And if anybody else wants it as well, just let me know. Oh, you've sent it, because we can make sure that we get this over to you if you want to just go over everything. And I hope that it was beneficial to you guys. Does anybody else have any more questions on the presentation or specifics for their animals? Or if you want this presentation emailed to you, please let me know. If you feel comfortable putting your email in the inbox or in the group chat here, or if you just want to email me and let me know, it's Claire, CLAIRE, @boulderholisticvet.com. But I really hope this was helpful, and I'm just going to stay on for a couple more minutes just in case you guys have any more questions or any thoughts. And I'm available after this. And in the future, I would like to put together a course. So if that's something you guys are interested in, let me know.
How do I type in my email address? Where at?
Yeah, what is it?
MY. How do I type in my email address?
Oh, you typed it in? Oh, how do you type it in?
How do I type it? How do
Are you on your phone or computer? Are you on your phone or computer?
I'm on computer.
Okay, so do you have the chat open? Do you see the chat at the bottom?
Yes, I do.
Okay, so open that, and then you can type it.
Oh.
Yeah.
Okay.
Perfect. I didn't know you guys could unmute yourselves. I'm just learning here, so thank you for your patience. Oh, goodness. Okay, Magic, what is your question?
Hi.
Yeah.
Can you hear me okay?
I can.
I got booted off. I don't know what happened, but anyway.
Oh, I'm sorry.
I know.
Jeez.
Computer problems. I have a question. I have a cat with asthma, and I was just wondering if you have any suggestions, especially if she's having an attack.
Yeah. Well, so I don't know, I would probably do the really gentle petting massage if she was having an attack. But you have like when she has an attack, what is your normal go-to? Like, what do you normally do?
I try to calm her down, and then I tap from the neck to the base of the tail, just kind of tap,
Perfect.
tap on each
Okay.
side of the spine.
Okay. And does she have an inhaler? Does she ever need like medical intervention with her asthma?
No, they're pretty short, like 30 seconds.
30 seconds. Okay. So like she can usually kind of come back and do you find that she's more anxious around that time, I'm guessing?
I think she's real sensitive, so if there's something stressful,
Absolutely.
that can trigger it.
Yes, absolutely. Okay. So you're finding that she might actually get triggered during those stressful events or not.
Well, I think, it's hard to say, but,
Okay.
I do notice she picks up on things.
Sure. Okay. I mean, I think definitely you can do massage, especially I would say, very gentle petting technique during that moment where she's having the actual attack. And then afterwards, I think you can 100% do a full sequence on her, because I know for sure that when I have seen cats having these asthma attacks, it's definitely going to tense up their body. And I think doing it, even if you did it, later that evening, even if you gave her a little bit of time to like kind of process through that and kind of settle down, because it might be that at that moment she might kind of be a little bit disoriented and not necessarily want it right then. But I'd say later on, especially in the evening when things have settled down, I think doing a sequence on her would be wonderful. And then the lighter, I would say really focusing on those strokes that help increase the lymphatic, so the immune function. So the petting stroke that we talked about, the effleurage. If you want did you already enter your email address? If you haven't yet, enter it and I'll send you the presentation because we go over all the strokes. But I'd say really focusing on the strokes that improve the lymphatic system and circulation, because helping her immune function during that time feels important.
So were you saying the entire session is about 5 minutes? Is that?
No, so it really depends on the animal. And I would say you're probably going to do a session for your cat. I would say it's probably going to become a 30-minute session would be great. I mean, in a setting where I go to the home, I allow for 45 minutes, but the 5-minute part is really the freestyle. So in the beginning, when you're doing your petting strokes, and then you're really freestyling across the body. But you can definitely do 2 minutes of freestyle. You can do 1 minute of freestyle. And the amount of massage that you can achieve is really going to depend on the animal. And I think what you're going to find is the more you do it with your pet, the longer the sessions are going to be. So I never feel like you should do it if suddenly it's becoming something that's really stressful for your animal. Don't feel like, oh, I really want to do a 30-minute massage, but I hit the 15-minute mark and she's clearly, ready to be done. I would say don't do that. At that point, just thank your animal, close the session, and let it be for that night. So there's really no amount of time. I mean, your animal will tell you, you'll know, but no amount of time. I would say for large dogs, in a home setting where I'm going to the home, I usually work about 60 minutes. But again, it wouldn't be wrong to do a 15-minute. It wouldn't be wrong. I would say if you can do one side and the other, that would be ideal because we want to kind of balance that out. But the most important thing is that you're connecting and that you're not doing something, against their will or consent, if you will. So I hope that answers. That's a long-winded answer.
I guess I need clarification. Freestyle that isn't making biscuits or
So
stroke. It's
all of them. It's incorporating them all. Yeah. So in the beginning, so the very first part of your sequence is going to be the petting stroke. So the head to the tail with your hands closed and your palms cupped. And then the freestyle is incorporating all the different strokes that we talked about. Very loosely, gently, all across the body from the head to the neck, to the shoulders, to the forelimbs, down the back, and down the legs, and then back up the legs. So it's the same, it's like a quick sequence. It's just using them all to feel for tension, for heat, for coolness, and for the reaction of your animal. And then you go back to the head and you start with, you don't do the effleurage anymore. You start with the making biscuits, and then you might do the circles, and then you kind of continue on with the body. I hope that makes sense.
Okay, yeah, I was confused about that. So
no, that makes sense. Yeah, that I see where you could get confused with that. Absolutely.
Okay.
Yeah, I hope that helps.
Yeah, thank you.
You're welcome. Yeah. Okay, let's see. Presentation. I'll definitely send the presentation. We talked about IBD. Okay, so Debbie, I would like the IBD massage. Well, so did you hear us? I don't even, oh, you're still here. So I hope you heard us talking about Joy's kitty, but definitely I think massage during a flare up. Oh, I see a new message. So maybe it's from, oh, no, it's Magic. Definitely hope you heard that, but I think that doing a massage, even not during an IBD flare up, can be really helpful. And I feel like I mentioned this before, but I feel like they have so much tension that they're holding from the stress of feeling pain, because being in pain causes chronic stress. And I also feel like the actual motion of vomiting, or the motion of having diarrhea, or the feeling of being constipated causes physical tightness and tension. So I feel like doing a massage during that time is I don't think there's anything wrong with that. And again, listen to your animal, because if your cat's having a really hard night and they're just like, I just want to be left alone, or I just want to sit in your lap, and I just want to have this moment, then honor that. We're not trying to push our animals to a limit here. We're trying to incorporate this experience in our home, and by doing so, allowing for the benefits to come through, but we don't ever want to make it something that's hard for them. So I hope that helps. And let's see, does anybody else have any other questions? Good, Debbie, I'm glad. And feel free to, if you have more questions, if you get off this call and you try to do a massage and you think like, okay, I really don't get this still, or I really feel like I have another question, please email me and just let me know. And I'm happy to talk to you about it. So I'm just going to put my email in. YouTube link. So in the presentation, I'll email you, but in here we have a video sequence. It's on a dog, but that's actually really helpful, which feels, I know, and I might be able to video it on my cat, but I feel like on a dog is a little bit easier. Just to know that it's the same muscle groups as a cat. And the only reason I think it's easier is because when you're learning, you can really see, like when you're learning through the YouTube video, you can really see this animal, you can see the muscles, and then you can use that on your own cat in person. And I feel like just visually for me, it helped me learn to see the dog, but I'm happy to see about doing a cat, but I just feel like you can really see the muscle groups. And then when you have your cat on you, working with you, you can really see them. So let's see, I have 10 other people still here. So does anybody have any other questions? I hope you guys found this helpful, and I want every animal to be massaged, because I think it's a game changer. So, okay, well, have a good night, and thank you for joining. And yeah, reach out to me. Let me know how it goes. Let me know what you're finding, and if it's helping, and I'd love to hear. Okay. I am going to, bye everybody. I'm gonna write these emails down, and then I am going to let you guys enjoy the rest of your night. You're so welcome, Debbie. All right. Have a good night, guys. See if I can stop recording here.